hypertension is a disease which is a lifestyle disorder. It means that your blood pressure in the normal language is high. So there are two readings in blood pressure which you generally see. One is upper one, another one is lower one. So the upper one is systolic and the lower one is diastolic. If your BP, the upper one is more than 140 and the lower one, that is diastolic, is more than 90, that is known as hypertension. As far as causes of hypertension are concerned, as I have already told, this is a lifestyle disorder, and the most common cause of hypertension is essential hypertension or a primary hypertension. That means there is no cause as such. And then there is secondary hypertension, which may be due to the involvement of the kidney, involvement of the thyroid, involvement of your adrenal glands, and there is a hypertension related to the pregnancy. And then there are certain drugs like excessive use of painkillers, the oral contraceptives in females, and certain other drugs which are the causes of hypertension predominantly. So basically, it's a lifestyle disorder. That means the risk factors are to be avoided, and those risk factors are age-related, number 2, the diabetes, number 2, obesity and sedentary habits. They are predominantly major causes of hypertension. Then smoking is another risk factor for hypertension. Another common disease which may lead to hypertension and which we ignore is obstructive sleep apnea. That means excessive obese people, those who snore during the night, and then you see that these people are having hypertension. Then dietary habits, excessive intake of salt, excessive intake of fatty foods, excessive sugar intake, they all lead to obesity and hence they lead to hypertension. Hypertension, as mentioned in textbooks, as people know, 50% of the people, those who are having hypertension, they are undiagnosed. That means in a population, half of the people with hypertension, they do not know that they are having hypertension. Why? Because there are no major symptoms associated with this disease. The only symptoms which one could see is they are the headache, which is early morning headache, especially in the back of the head, sometimes feeling of nausea, sometimes feeling of giddiness, or the symptoms could be once there is an end organ damage, that is the damage is due to hypertension causes damage to the organs, and that manifests in the form of heart attack, in the form of heart failure, in the form of peripheral arterial disease, then in the form of stroke, which is affecting the brain, then the eyes and the kidneys. So predominantly it does not cause major symptoms. It only manifests once you have end organ damage. So the idea of telling all these things is monitor your blood pressure, measure your blood pressure, and then manage. So hypertensive retinopathy is the end organ damage due to increased blood pressure. So retinopathy means it's a part of eye. So retina जिसको आप बोलते हो. So once retina is affected, that's known as hypertensive retinopathy. It can be diagnosed only by an ophthalmologist or a physician with the ophthalmoscope. But you will have symptoms like visual disorders, you will have symptoms like floaters or any visual disturbance you have with the blood pressure. Go to your doctor, go to your physician or an ophthalmologist so that you can get your eyes diagnosed. Now first I will talk about how to diagnose hypertension. So everybody after the age of 30 should have once BP recording, and the BP should be recorded ideally in an atmosphere which is calm. You should sit before recording the blood pressure. You should not have smoked, you should not have taken tea, you should not have taken any stimulants in the form of cola, and then the first time blood pressure should be measured in both the arms. So as mentioned, it is a lifestyle disorder. So all these, there should be no smoking, there should be no alcoholism, there should be exercise daily, you should maintain your body weight, and you should decrease the intake of salt. There should be no added salt. These are the lifestyle measures to maintain blood pressure. And believe me, this is not a disease for which you have to have lifetime drugs. Once you maintain this regimes which I have mentioned, your blood pressure can be controlled. There are drugs for blood pressure which are AC inhibitors, ARBs, calcium channel blockers, beta blockers, diuretics, a host of drugs, multiple list of drugs which are there for an indicated patient, which will be prescribed by your doctor. Take it regularly. So as you know that World Hypertension Day is coming. So World Hypertension Day, that this time theme is measure your blood pressure accurately, maintain it, and live lifelong. So hypertension prevention, as it is a lifestyle disorder, so follow certain things so you can avoid your hypertension. The first and foremost is avoid obesity. That means you should not be overweight. Maintain your weight, maintain your waist, which should not be in the range of obesity. Maintain your body mass index. Low salt intake, that means no added salt. All processed foods, all packed foods, they have salt. Salt restriction is the one which will be preventive tip for hypertension. Exercise daily, at least 30 minutes in 5 times in a week. That should be the regime every day. So another thing which you might have read or you might have heard is the DASH diet. DASH is what? DASH is dietary approaches to stop hypertension. There was a major study which was conducted in certain countries, and we found that if you follow strict dietary regimes, and the first and foremost dietary tip is decrease the sodium intake. The sodium intake should be less than 5 grams per day. Now you see that people say that take low sodium diets. That is also not low sodium salts, which is available in the market. So no salt is the thing which is best and which should be done. Increase your intake of fruits and vegetables. That's very important. Increase the potassium-rich diet. That's very important. That is the lime fruits. They are very rich. Then increase the intake of nuts. Decrease the intake of raw sugars, or which you call as the refined sugars. They should be decreased, and maintain your body weight. These are all the tips for dietary process to stop hypertension. In fact, once you are first time diagnosed with hypertension and your blood pressure in the range of less than 140 and about 85 to 90, the lower, that is diastolic blood pressure, this is the first treatment, first guideline which the doctor says to you, maintain this. If you can maintain this, you can avoid the blood pressure drugs also.